Hello, hello, hello. This is Truth Be Told, Dr. Kyle Dumpert.
Dr. Walter Aka. We have no guest with us today
Now,
because I called Kyle and I told him that I need basically, what do you want to call it?
a
Therapy
therapy
session?
session. Yeah.
Yeah, let's call it therapy session. This week has been probably one of the most, the hardest, longest week in dentistry for me, to be honest with
Okay.
you. And so let's just start from the beginning, right?
Okay.
And I'm going to ask a few questions, and you're going to help me. You're my therapist, so I
Okay.
appreciate
Okay.
you taking time out of your busy day to help me.
Absolutely.
You know, so so
$300 an hour fee. Or
okay. Well,
we'll start the clock right now.
I'm not paying you anything, but okay. You know, okay. Let's start with this. Ready? When we decided to go to dental school, we knew that it was going to be tough,
Right.
right? We knew what we were getting ourselves into,
Yep.
right? Uh, Here's the thing that I don't understand. We all go to dental school. We all learn about the same thing, right?
Right.
If you want to learn more, you expand your knowledge, become a specialist, take CE courses, whatever it may be,
Right.
right? Okay. Um, you don't. Would you ever go and fix your car without reading something about it, either on YouTube University, Google
No.
Google doctrines?
No.
Like, would you ever do something like? Would you just
Just
okay?
jump. No. You not just jump in, especially with something
Right.
worth
Right.
anything.
Right. Would you ever buy something that's worth like 50,000 or more without knowing how to use it?
No.
Right. Would you buy a car without knowing how to drive?
No.
No. Okay. So this is what I'm noticing. A lot of people buy stuff but don't know how to use it in dentistry
Okay.
or depend on other people. Like, for example, if you bought a car, would you call the person who sold you the car and say, "Hey, you really need to teach me how to drive this car"?
No.
But a lot of people buy CBCTs because hey, I can charge for it, I can do more implants and stuff, but they don't know how to read it.
Okay. This is a good conversation because I'm buying a combi.
Okay, I'm telling you right now, Kyle, if you call me asking me how to fucking read anything in that CBCT, one, our friendship is over. Two, I'm gonna come over there to Pennsylvania and kick your ass personally. Okay. No, but this is what pisses me off because there's so many dentists that are buying CBCTs because they think it's a cool thing to do. It's where we're going, right? And I do believe CBCTs are amazing tools, but you need to know how to read a CBCT before
Right.
you buy a CBCT.
Absolutely. Absolutely.
This is the problem. There's so many people that don't know how to read it. And then they basically send a patient to you as a referral saying, "Hey, I want an implant. Can you read it and let me know if you can do an implant?"
Wait. So the dentist
Yeah.
is taking the scan,
Taking a scan, charging the patient,
okay, and then
and
they're
then
sending
saying
it to you.
and
Figure it
saying,
out from here.
figure it out from there.
Wow. Okay.
Or I don't know how to read it. Can you show me how to read it?
Wow. Okay. No,
Yes, that's what's
that's not a
happening.
good approach to take.
That's not a good approach to take. But guess what? Financially, that's great for them, right? Because you've taken a CBCT, you get to charge the patient, but then you forget that you don't have to read it. And a lot of people don't realize this, right? Anytime a doctor takes an X-ray, for example, medical doctors will send you to a radiologist
Right.
to take an X-ray because the radiologist will read the X-ray and basically write a paper or a report that says this is everything that I see
Right.
in the X-ray.
Right.
Dentists, we don't have. I mean, we have dental radiologists, true, right? But
Yes.
most of the time, we take bite wings, we take panoramics, and we're responsible for knowing the anatomical structures,
Right.
knowing what's on the X-ray. So if there's something that's not correct or not what it's supposed to look like, we should have enough knowledge to at least say, "Let me send you someone else that does."
Right. Right.
But if you take something like a CBCT, you don't know how to even read it.
Right.
You don't know what you're looking at.
Right.
You don't know what you're looking for.
Right.
So then why the hell are you taking a CBCT?
Yeah. No, I agree with you. I'm getting one not so I can take the scan and send it to a specialist. It's so I can get the scan and use it so I can treatment plan, I can diagnose, and not have to send people to a specialist.
Okay.
That's wow.
Or let me ask you this. If you do diagnose and you realize, hey, I'm going to need to do a ridge augmentation here. I need to build this area up a little more.
Right.
Now you have an idea, and you can say to the specialist, hey, I did the CBCT. I got measurements of this, this, and this. I need a ridge augmentation to develop that area.
Right.
Right. And then you take the CBCT again and say, oh, after your surgery, we got this, this, and this. Now you have better communication with your specialist.
Right.
Right. Okay. So then this comes on to my next topic.
Okay.
My second part, doctor. Whenever we were in dental school, okay, Kyle, you and I went to the same school.
Yep.
We all went to dental school, right? That's how you become a dentist. For
Yep.
those that don't know, you go to dental school, you become a dentist. Cool.
Right.
We have a basic knowledge level platform. What we're supposed to know is most general dentists, we like to consider them, at least I like to consider them, people that basically they're the bus drivers.
Right. Yep.
And we're all in the bus.
Mhm.
Okay. The bus driver takes us to where we're going.
Okay.
So if you're a patient and you go to your general dentist and you say, hey doc, my mouth is a complete mess. I want a beautiful Hollywood smile again.
Mhm.
Your dentist is supposed to say, cool, let's have a sit down. Let's take impressions. Let's take x-rays that I know how to read. Let's take impressions that I know how to take. Right? You go through all these things, and then you do exam. You use your laboratory. You use everything to kind of get an idea, a game plan.
Right.
The only team that I've ever seen, and I mean, I've seen a lot of games. Like, for example, recently, the 76ers blew a 26-point lead.
Okay.
In the playoffs. Okay.
Yeah.
One of the biggest leads that, I mean, literally, you could have held the ball and probably still won the game, but they blew it. Okay. That's lack of game plan.
Right.
Right. You went in there with a game plan. Something happened and you couldn't change or manipulate the game plan to win.
Right.
If you're a general dentist and you don't have a game plan, you're going to lose.
Right.
Right. So this is what's happening right now. General dentists are sending patients to me. And again, if any general dentist is out there listening and you want to tell me I'm full of crap and I don't know what I'm talking about, please come on a podcast. I really do like arguing today. But general dentists are sending patients to and saying, treatment plan the patient for me. Let me know, can you do implants? Let me know, how many implants you want me to, how many implants we're going to place here and so forth. It's not, hey, Dr. Aka, I have this patient, based on everything that I want to do with the patient's consent, or I've talked to the patient, they want this, this, and this.
Right.
So can you do this? That's how the interaction should be.
Right.
Your general dentist sends you to me, and they say, this is all I want to do. I want to do all this.
Right.
Can you do this?
Right.
And then my job is to say, yes, I can do this, or no, there's not enough bone here. I need to do this, this, and this. But in the end, I'm supposed to be, hey, Kyle, I can do everything that you wrote down for me because your plan is what I'm going to follow.
Right. Right.
It should not be, Kyle, here's the plan.
Yeah.
Are you okay with this?
Right.
That should not be the way it works.
I completely agree with you.
But this is what's happening.
So you're seeing this from
everybody, by the way. It's not just like the people that I work with directly. And no, it's everybody.
Is it just recent grads? Is it because they don't have that experience, or are you seeing it from older dentists also?
Older dentists also. I feel like everybody's become so complacent. They don't want to deal with patients or tell patients that they can't do something.
Okay.
Right? There are some times where you just have to say, it's going to cost a shitload of money. Excuse my language, everybody is listening. It's going to cost a crap load of money.
Right.
And but you have to know this is what you're getting yourself into. You can't promise a Lamborghini when the patient has a budget of a Volkswagen. You can't do that.
Right. Yeah.
You have to say this is your budget,
right? Because
you and I had a conversation. We sat down and I showed you this is the worst case scenario, right? Or you can say to the patient, I don't know how much it's going to cost, but based on everything that me and the specialists have worked on together in the past, if you've done one implant and that implant cost maybe $2,000, and the patient wants 4 implants,
Right.
including bone graft, not including surgical like ridge augmentation or anything. Just 4 implants. You multiply that by 4, so 2 times 4.
Right.
Basic math, guys. We're doing
Right.
basic math, right?
Right.
That's 8. Okay, so
Yeah.
you can sit there and tell the patient it's going to cost roughly $8,000.
Right. Right.
Do you, Mr. and Mrs. Smith, have $8,000?
Right.
If they say there's no way in that I'm gonna spend $8,000 for my mouth, then you've eliminated those 4 implants, and now
Right.
you can say, based on that, we're not even going to talk about that.
We're not going to go to the Cadillac plan.
We're not going
move down from
Cadillac.
there.
Yes.
Yep.
Now let's go to the next level below, and then you
Yep.
keep going until the patient says, "This fits me more,"
Yep.
or "It fits my budget." But
Right.
that's not the discussion people are having. And this is what irritates me, Kyle.
So, do you think would you prefer the general dentist have that conversation, or do you think like some general dentists don't have a personality, can't? I know we don't like to sell dentistry, but we don't.
But that's exactly what it is. I mean,
Right, it's selling dentistry, but
you're selling. To me, it's not like you're not a salesperson. You're not like a used car salesman.
right,
You're basically trying to sell dental health to patients.
right,
You're trying to sell something that they need. You know, one guy, I think I said this to you before, but one guy told me he used to sell what's it called? Timeshares.
yeah,
And he was like, I can get somebody to buy a timeshare. I don't understand how it's so hard for you to get somebody to do something that's good for their health.
right,
And when he said that, I was like, holy crap. He's right.
yeah.
So why are we so afraid to just tell people exactly what they need? If they don't do it, that's fine. That's your health.
Right.
I'm still going to sleep tonight. I'm not the one that's in pain.
Right.
You know, it's your health.
When I think of selling to, whenever we're selling to a patient, we are trying to do what's best for them.
Hopefully. And that's not always the case, by the way.
It isn't.
No.
But when I think of a general dentist who is doing most general dentists are doing, maybe a couple $1,000 cases, a couple of crowns, they're maxing out the insurance benefits and, that's it, we're done. So a lot of general dentists don't have that experience, myself included, of selling a $30,000, a $50,000 case.
Okay, well, let me ask you this. Is it you don't have the experience of selling 50, or are you just uncomfortable with that big of a treatment plan, right? Because maybe they may need multiple implants. They may need like occlusal adjustment, things that like a prosthodontist would do.
Right. And that's why I know I have the skill set to do it. I don't want to do a $50,000 treatment plan. That's when lawyers get involved. That's when expectations, if they aren't met, that's when you get unhappy people. So I would rather, that's what specialists are for, in my opinion, to do those bigger cases, like a prosthodontist.
Well, okay, let me ask you this then. And this is another discussion, right? Just because you can't do it doesn't mean it doesn't exist.
Right. No, right.
I get that a lot, though. I get a lot of people that keep getting deep cleanings when they should get surgery to basically correct for their issue.
Right.
Right. And a lot of the general dentists don't want to send them out because I don't do it. So why would I send it out and lose that patient potentially to somebody else, or I might lose that revenue?
Right. And as doctors, we should be giving all of the options and leaving it up to where our job is to inform them. This is your condition. These are the treatment options. Cadillac, new Chevy versus used Chevy versus, $1,000 car. These are what your options are, the benefits and pros and cons of each treatment option. Which route would you like to go? I think there are some people like ClearCorrect. No, what's the implant all on for? Is ClearCorrect? I think ClearChoice.
No, ClearChoice.
So they know how to sell a $50,000 case because that's all they do, right?
Right. Yeah, they had prosto on there and oral surgeons.
They're completely comfortable for that.
That's who they hire. Yep.
If the patient has to lose all their teeth and they come in my office and I say, look, this is this is going to be a $50,000 case to have all your teeth taken out, and the best thing for you, you have dry mouth, you have high caries rate, you have all this stuff, you have a high palatal vault, you're never going to wear a denture. Your best option is full mouth rehab with implants.
Right. Mm-hmm.
Well, how much is that going to cost? Well, you're probably looking at $50,000.
Right.
The patient, well, no, I don't want to spend that much on my health. God forbid, I have to spend money on my health. But at that point, I'm not experienced enough to sell that $50,000 case to make that emotional connection with the patient for them to want it enough to spend $50,000. So in that case, just go talk to them, see what they have to say. And at that point, I'm relying on those specialists to sell that case. But I am still giving the patient the basic information. I'm not saying, look,
right.
Your insurance is $1,000. They're going to maximize your insurance for you and then leave it at that. No, you give them some context, but
exactly.
Like you said, roundabout numbers are good, but for people that are doing that type of work all the time, I'm relying on them to, whatever they do to sell cases or to
Right.
inform the patient, they have a lot more experience in making that connection with the patients than I do.
Right. And again, like I said, I'm not asking you to do my job for me. That's not at all.
Yeah.
But at least give the patient a broad understanding of what's
Right.
happening.
Right.
But that also involves you actually knowing what's going to happen.
Right.
Knowing what what a osseous surgery is.
Right.
Knowing that, hey, this bone is really thin.
Right.
For example, I had a patient this week, wonderful lady, and I basically went down and broke everything down to her. She said, "This is what I want." And I said, "Okay, you want this? You don't want this?" And I listened to her, right? And I said, "Okay, based on everything you said, we need to do what we call a block graft, which is take bone from one part of your jaw and put it in another to build the bone up, so we can do implants later on." Mm-hmm. I don't do that. I don't do that in the sense that I don't sedate people. I don't put people to sleep to do that.
Right.
I don't think anybody should do that awake.
Right.
I really don't. That is a horrible, horrible idea.
Right.
So I sent it to an oral surgeon.
Okay.
That I knew did that and sedated the patient.
Yeah. Mm-hmm.
Right. That case could potentially run $20,000.
Right.
If I was a piece of crap dentist, I would have been like, "You're staying with me. I'm making all that money. Blah 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 blah."
Right.
But I was like, "No, I'm not your guy."
Yeah.
And the funny thing is, it was a friend of mine's mom.
Oh.
And I'm like, I am not. And they literally came directly to me. And I said, "I'm not your guy. But what I will do is explain to you everything that's going to happen."
Right.
The oral surgeon is going to go more details with numbers. But look for this. Think about this. Ask this kind of question. So now I'm preparing them. So when they go there, they have a better conversation. Right. So they understand it even more in depth.
Right.
There's nothing wrong with doing that.
Right.
We have to get out of our way and out of our pockets and stop being so damn selfish when it comes to patients. No. Patients care enough to say, "Thank you for being honest. Mm-hmm. I'm going to refer other people to you because you were so honest. You could have just said, 'No, let me do this myself,' and go through all this misery."
Right.
But you didn't, and you sent me to the person that you thought was going to do the best. And if it ends up being a great situation, she gets the results that she wants, she's going to send more patients to you.
Yeah.
Because now there's a trust situation.
Right.
But a lot of dentists don't want to believe that. They think if I need to hold on to the patient so tight. It's like a goofy looking like nerdy guy dating a hot model. He wants to, I'm going to do everything I possibly can to heal. The more you hold on, the worse it's going to get.
Right.
It's going to look awkward. Everybody's going to be sitting there going, "Oh, come on. You guys don't belong together. Come on."
Right.
No offense to any Revenge of the Nerds situation.
Right.
Don't get mad at me,
Well, it's the same thing as patients that have severe attrition or wear of their teeth. I had several of those in the practice that I bought. And whenever I came in, I told them, "Look, you have a lot of wear on your teeth. You need to get this fixed. I'm not your guy to fix it.
Right.
You need full mouth rehab. You need crowns. You need, vertical dimension opened up, all this stuff." Well, nobody told me that before. I've been coming here for 20 years. Mm-hmm. Well, I can't speak of what happened in the past, but this is where
Right.
you're at now. I'm not comfortable enough to do this treatment for you. Here's a prosthodontist number. You need to call them. And you're probably looking at, if a crown's $1,000 at my office,
Mm-hmm.
you're looking at, at least 28 crowns in there if he has all his teeth. And that gives you a rough idea. I don't know their exact numbers, but
Right. You could be like 2,000, 3,000,
right,
but if you work with them, you can kind of get an idea of
right,
how much roundabout, right?
right. But yeah, it's our job this is what's going on, and to, as you say, quarterback and give them their options as far as, I can't fix it here, but this person is who I would send my own family to. This is who I would want doing my work for me.
That's it. That's it.
Yeah.
And it doesn't have to be the same person, by the way, right?
Right.
There are specialists that are very good at certain things.
Right.
Like you can send it there. Okay, we'll talk for perio again. I'm a periodontist, so I can talk crap about my own people. I'm okay with that. But there might be one guy who does implants, amazing implants, but
Right.
sucks at doing like osteosurgery.
Right.
And there might be a guy who does osteosurgery really good, so you send that to that person. There might be a guy who does like soft tissue, it's like beautiful soft tissue. You send it to that person.
Right.
So within a specialist, there are people that just do things way better than others do.
Right.
And that's perfectly fine. Like, you don't have to sit there and say, I'm going to keep sending it to this person. You can say, no, they're good with this, but they suck at this.
Right.
Let me go ahead and send it accordingly.
And that's where medicine's
as a quarterback,
at.
Say what?
That's where medicine's at, right? You don't have, the general practitioner doing everything. You have specialties, subspecialties. You have, people that will just not only work on the hand, but maybe they specialize in the finger or whatever. That's a bad example, but they are so specialized that, like the eye, they have to go to somebody for the retina. They have to go to somebody for cataract. They have to go to somebody for, whatever it is. And dentistry has pretty much avoided that, where I'm licensed to do anything that you're licensed to do.
Yep.
And you're a specialist, but I can do it if I want to.
Yep. And the funny thing is, why, and I hate to say this because I love Randall Cunningham, Eagles fan. I don't think Tom Brady is as great as he thinks he is, but he's won multiple Super Bowls. And you know why he keeps winning? Because he doesn't just keep going to he doesn't keep going to Gronkowski, right? He doesn't. He dishes it out, so you never know where he's going to go. But in the end, the results are the same touchdown.
Yeah.
Right.
Yeah.
That's exactly what needs to happen when you're a general dentist. You're in charge. Like, you let us know what to do.
Right.
You get in the huddle and you say, okay, I'm going to go to you for this. I'm going to go to you for this. And I'm going to go to you for this.
Right.
But we don't have general dentists that are comfortable or confident enough to do that. Why? Because they graduate school barely knowing anything.
Yeah.
And they're supposed to be in charge of the team. Can you imagine if and this is very lucky that, Patriots got somebody like this. The last or second to the last pick, you get this Hall of Famer. That doesn't exist. That doesn't happen. Yeah. Usually the last guy doesn't even see the playing field. Let's be completely 100, right? So imagine being that guy, right? You barely did anything in dental school. You get out and you're supposed to quarterback all this stuff. This is why I tell everybody you need training camp. You need a residency. You need to get their confidence up so you understand what you're talking about.
Right.
You call me and you tell me a patient needs osteosurgery. I'm expecting deep pockets. I'm expecting pus. I'm expecting something.
Right.
If a patient comes to me and just needs a prophy, I'm going to be, what's your dentist talking about? I'm judging you hardcore.
Right. Yeah.
Because you clearly have no idea what you're talking about.
Right.
And this is the issue, bro. Like, I'm gonna get off my soapbox and we're gonna move on to something else. My third part of this week.
Well, if we had an endodontist on this show, I'm sure they would say a lot of general dentists will just refer a tooth also to an endodontist for a root canal and to evaluate. Please root canal evaluate for restoration or something.
Right. And if we had an endodontist, they would be like, they'll probably say, I can always root canal anything.
Right.
You see,
they can root canal a root tip that's left in the mouth.
They can root canal a stump.
Right.
They can root canal a tooth, a stump from a tree. Okay. what's that one saying? To a hammer, everything is a nail.
Yep. Yep.
Yeah. So don't send anything to us if you don't expect us to do what we're trained to do.
Right. Yep.
Right? You tell us what you exactly want us to do, or call us and say, "Hey, I'm kind of confused about this. I need your input."
Right.
That's okay because there's no patient in front of us.
Right.
I'm more than happy to give you an input. I'm more than happy for you to send me X-rays, send me things, and be like, "Hey, what do you think about this?" Now that's a dialogue.
Yeah.
But when you send a patient to me and I'm sitting in front of the patient, I'm like, "What the hell do you need from me?" That's a
Right.
bad idea. That's a bad sign because it makes me look stupid. Makes you look stupid, and
Yeah.
I'm
It
just
makes
trying
the
to help
general
you out.
dentist look stupid.
Right. But it doesn't make us look good because it's like, hey, well, don't you guys know what you're talking about? You're saying this and this person's saying this. It never makes anybody look good,
Right. Yep.
you know? But I digress, my man. I wanna I know you don't want to keep me for this therapy for too long. You know, I'm paying by the minute. All right, the last thing. This week has been tough for assistant.
Okay.
My assistants. Okay, let me explain what I mean. So I had a new assistant come on, so I can train her.
Okay.
Right, really nice girl, really nice girl. There's two parts to this, right? After the second day, she says, "Doc, your team is very negative.
Mm-hmm.
They fight with each other. They don't really help me out. They're not doing anything beneficial for me at all. I keep asking them stuff, and they're like, 'Oh, go do whatever. Who cares?' Da da da." And from literally from morning till afternoon, all they do is complain. At least one of them, all they do is complain.
Oh.
And I'm like, "Huh, okay." And she's like, "Yeah, this is just very draining."
Yeah.
So I have one person that's just a complainer the whole day. And I have another one who doesn't seem to care about their job and purposely slows down just so that they can kind of milk the clock in a way.
Okay.
This is what I'm hearing.
Okay.
How do I deal with something like that? That's the first thing. And then this new girl has, on paper, looks amazing. 10 years of experience, been to multiple offices. So I kind of red flagged that, right? But then from the from a clinical hands-on part, you would have thought that she's never assisted before in her life.
Okay.
And I said, that's unusual. Your paper, I mean, your resume says one thing, but
Yeah.
your actions are saying something totally different.
Yeah.
Yeah. And so then I dug into it more because again, I'm not responsible for hiring when it comes to this company. They just say, hey, Dr. Aka, if they can get through you, they can get through anybody. Okay, cool. I'm a dick. Thank you. I'm an asshole. I get it. Okay. So then I'm like, let me have a conversation. And I basically talked to her. And when you dive deep, you realize that most of the time when she was an assistant, it was
Mhm.
basically go to the front and do the front work. So
Oh.
she barely assisted.
Yeah.
And it shows.
Yeah. Huh.
That's the issue. So first thing is, how the hell do you deal with negative assistance? And I'm actually about to be like, both of you guys separate,
Yeah.
go somewhere.
Right.
How do you deal with assistants that kind of bringing the morale down? And how do you deal with lazy ass assistants?
Well, do you have an office
Doctor,
manager?
say what?
Do you have an office manager?
Well, yeah, but again, the vibe is still in the air, right?
Okay. So
There's still negativity in the air.
whenever I've had staffing issues at my place, shortly after I bought it, I had a hygienist that was just, she contradicted everything I said. She had worked there for 20 years and she thought it was her office, not my office.
Right.
So when I came in, I told everybody, this is what I expect. And as she continued to kind of undermine my authority at one of our staff meetings, I said, you know, today I'm putting on the little dickhead hat. And you don't want me to put on the big dickhead hat, or else you're not going to like me.
Right.
So I made some, these are my expectations.
Mhm.
And things continued to happen that I wasn't happy with. So that I had to put on the big dickhead hat, and she got fired, and morale improved.
Right. Right.
Recently, I had to have that same conversation with the staff, uh, where we have a list of agreements. Open and honest communication,
Hmm.
playful out. Support each other.
Right.
Uh, you know, uh,
Yes.
different things that we all agree upon.
Right.
And I had to call everybody out and say, I do a bonus system at my office. And I said, does
Okay.
everybody like the bonus system? Yes. Does everybody want to keep the bonus system? Yes. Okay. Well, what I've been noticing is I have some employees that do an amazing job, work hard, over and above everybody else. Then I have some that when we were in school, I always hated group projects because somebody is always doing the work and others are
Mhm.
riding on their coattails.
That's right.
And I'm seeing that now. I'm not mentioning any names. If you think I'm talking about you, then I probably am.
There you go.
So if you like your bonus and you want to keep your bonus, everybody needs to support each other and everybody needs to contribute. If you don't, then the bonus is going to change to something else that you're not going to like.
Right.
And I find money was a powerful motivator, and that got everybody back on the same page. Now, I think humans have a tendency to revert to the lowest
Mhm.
amount of effort possible.
Mhm.
So
Mhm.
every
Mhm.
so often you have to put on that little dickhead hat, and hopefully you don't have to put on the big dickhead hat. But that's how I've handled things in my office so far that have seemed to work out good. But I don't know how much pull you have
Right.
with those
Right.
kind of decisions.
Yeah, no, I mean, in the end, I can choose, and I can definitely make a decision on who I want to work with. You
Yeah,
know, but one thing I've always done is I've tried my best to make sure that as a unit we work well together, right?
right,
Because we're all in the same, like, I like to call it the same boat. We're on the same boat, right?
right,
In the end, if there's a if there's a hole in the boat, we're all gonna sink.
right,
So again, I need to make sure that there's no hole in the boat, and if there is, we need to patch up that hole,
right,
right? Have a conversation with each other, talk to each other. I am not your mother, nor am I
right.
your father. It's Father's Day. Happy Father's Day to all
Happy
the fathers
Father's
out
Day.
there. We work hard. Actually, some of us do, some of us don't. I don't. If you don't work hard, you're a deadbeat, and I don't like you. And I'm gonna tell you that right now. I hate you so much. Kids didn't choose to have you, so remember that. Okay, do your best. Happy Father's Day. Uh, but no, honestly, right? I'm not your parent.
Yeah,
I'm not here to babysit you.
right,
I always tell everybody, I'm like, if you do your job, you'll never hear from me.
right,
You'll never hear a single thing besides me cracking jokes, having a good time, laughing with you.
right.
If you don't do your job, you're gonna hear from me.
Yeah,
And most people don't like it when they hear from me because, like you said, little dickhead hat. I would say I just basically turn into somebody you just don't want to deal with,
right.
and then the whole environment is just kind of like, oh crap, And
Yeah,
I don't want people walking on eggshells.
right,
It takes me a long time to get to that point. Once I get there, it's not fun for anybody.
right.
You know
Yeah,
what I mean? So that's the thing that I'm actually getting to that point. I'm getting to that point. And for me, I'd rather just get rid of both of you and not have to deal with anything.
yeah, yeah,
Think about it. I'd rather just say, let me clean slate
yeah,
because clearly you two are butting heads.
yeah,
It's affecting patients. It's going to affect the environment. And when other people are coming to me and saying, man, you guys are some negative ass people, that's
yeah,
not a good vibe. Like, you are representing me. Why would somebody who just started working tell me how horrible and negative you people are?
yeah, yeah.
That doesn't make anybody look good.
No, and you
We're
got to
supposed to
pick
be
out that which one's the bad apple that is causing
right.
the issues and get rid of her.
Him or her, actually. Let's be completely honest. I have no, I'm being serious. I have a young lady that works for me, and a young guy that works for me. And
Yeah,
I'll be honest with you, like, if and I've said this to them, I'm like, if you're not happy, go, leave.
right, right,
One thing I can't stand is for people to think that they belong somewhere they don't. Social
right,
media has made people think that they're worth more than they really are.
right,
Honestly, I am never going to dunk or play like Jordan. Just
right.
because I watch a few Jordan videos doesn't mean I'm Jordan.
Yeah,
Yeah, he makes it look easy
yeah,
because he put in thousands of hours.
yeah,
He is naturally gifted.
yeah,
I may make a procedure look easy. That doesn't mean as an assistant you can do the same.
right. Yep.
Okay, just like I know I'm a bad assistant. I
Mm-hmm.
learned that in dental school. I'm a horrible assistant, right?
Right,
If Kyle said, "Hey, well, can you help me with this surgery?" More than likely, I'll get in the way of him
right,
actually finishing that procedure in a timely manner. That's why great assistants are so hard to find. And
Yeah.
that's why we love great assistants. And we will
Yeah.
do, hopefully, most doctors will do whatever it takes to keep those assistants because they're
Right.
amazing and they
Right.
make our lives easier. But
Yep.
one thing you are not is Beyonce. You
Right.
cannot sing like Beyonce. You don't look like Beyonce. You don't act like Beyonce.
Yep.
Don't be Beyonce if you're not Beyonce.
And that might be a conversation to have is, hey, I've noticed that you bring a negative energy into this place. Is this something you're truly happy doing?
Right.
If not, I want you to be happy in life and fulfilled with the work that you're doing.
Yeah.
Maybe you should, really, if you want to be here, show it, or let's try to find something that you do like doing.
I don't think people understand this, and this goes for everything, right? If you're really good at something, people want to keep you around. They want to refer to you. They want to work with you.
Right.
Right? Do anything you can to make sure you're happy.
Yep.
But if you're not good at something and you think that you are good at it, but people are like, nah, I'd rather you not be here, then you leaving isn't going to change anything. If anything, it's going to make it better.
Mm-hmm.
So this goes for everybody. I'm going to put it out there, Kyle. This goes for everybody. Realize your actual worth.
Yeah.
If you are good at something, people will always tell you, hey, you're amazing at this. Thank you so much. You're doing great. If no one says that to you, you're not good at it. Right? If it comes down to the last shot and I have Kevin Durant or me, I pray to God that no one gives me the ball. I'm literally going to be like, no,
not me.
Go to him. Go to that guy. Kevin is on the other end. He's got this. You see what I'm saying? So no one compliments you. No one acts like you're amazing at what you do. Neither one, you got to get better.
Right.
And there's nothing wrong with getting better.
Right.
Or you got to say, this may not be for me because I'm so negative. I'm so just beaten up by this environment that I don't belong in.
Right. Yeah.
And that goes to dentists too. If you're a crappy person to your assistants, or just you make the environment just negative, quit dentistry.
Yeah.
No one wants you to be a dentist.
No.
And that includes your assistants that you hired.
Yeah.
They'll rather go find another job.
Yep. And that's why you can't keep staff. That's why you have to spend 20% on marketing to bring new patients in because they don't like you. Your staff doesn't like you. You should probably find another job or figure out what you need to change to be happy at your job.
I mean, what more can we say, Kyle?
Yeah. Yeah.
I felt like this was more of a therapy session for everybody else, but I enjoyed this. I got a lot of anger out because this week has been incredibly long, man. It was just incredibly long. I mean, great day today. I got a chance to go to eat last night. And never take a 3-year-old and an 18-month-old to a nice restaurant, expect them to eat anything that's on that menu besides fries. Okay. Yeah. And then my daughter, the 18-month-old, has discovered I say ketchup, but people call it ketchup, or they're different pronunciations. Okay. Heinz. Right. And so she's discovered this. And so what she does is she'll take the French fry and they'll dip it in there and then just lick that.
Oh, okay.
And I keep telling her, hey, you can eat the fry with it.
Yeah.
But that angers her. When I interject any kind of opinion, that pisses her off. Uh-huh. So last night was more of like, let me just slurp on this and eat the fry as I want to, And then we bought we went to a steakhouse, right? And it's funny because, it was for me. My wife was like, "Oh, let me take you guys out." We just couldn't find a babysitter, so we took the kids.
Okay.
Steakhouses are jackasses because they have nothing for kids.
Well,
but ready? But chicken tenders.
Yeah.
Which are dry.
Yeah.
And then they're like, "Oh, well, you can get a steak for them," and they basically put all this pepper on the steak, so they didn't want it.
Well, when you take I don't see a lot of steakhouses advertising for kids either. So
no, Kyle, they had a kids menu. Okay, don't try to do that. Don't try to do that. All right, because you make me seem bougie. Don't try to do that. Okay, this is not my
I'm going to take if I had kids and I was going to take them to a Michelin 5-star restaurant or whatever, I'm not going to expect to see chicken nuggets and mac and cheese on the menu.
Well, you know what? If it was a Michelin 5-star, they should maybe have something for kids. Because not everybody can find a babysitter. Okay, they need to be more sensitive towards the parents. Because guess what? We like to leave. We like to go out. We like to have a good time. And the funny thing is, it was funny. Usually, when you go to some of these restaurants, you get there, you have to valet park. You have no parking at all, right? Because it's like it's a busy time, right? You go around like 8, 9 o'clock, or whatever. We went there at 5:30. Okay. We went there at 5. That's their dinner time. So we went there at like 5:30.
All right.
There was like no one there. We literally parked in the front. Usually the front parking is safe for like the Lamborghinis and nice cars. Not my Nissan. I parked my Nissan, my tinted window, like the little shade for the sun to block the sun. It was embarrassing. Yeah, I know that they were like, man, we need to get this out of here so that we can get the nicer cars in the front, But I was happy because like we walked in and there were other people that had kids that went there. And we were leaving. They're like, "Oh, happy Father's Day!" You can just tell who's miserable, who's not. People who have kids and who doesn't. Like the people that had kids are like, "What was I thinking?" They're all just coming out just exhausted. The people that didn't have kids or had babysitters are coming in there looking refreshed and happy. And I'm like, "You guys can all go to hell." You know what I mean? You're too damn happy. You're like laughing at the table, and I'm like, "Please don't touch that. No, move that glass from her." It was a horrible idea. So Kyle, I'm gonna tell you right now. For future reference, never take your young kids to anything nice.
Okay.
This is why we have McDonald's and Pizza Hut and Chuck E. Cheese's because they know the quality doesn't need to be there. Just get you in and get you out. And pizza.
Well, you're going to have to learn to plan ahead a little bit better.
Kyle, I need you to shut up. Okay, I didn't ask for your opinion on this. I didn't ask for your goddamn opinion. Okay. You know how hard it is to find a good quality babysitter, Kyle?
I haven't a clue. No, I don't.
We were not.
Real idea.
It was a last minute effort. This is what happens when you have kids. You don't plan ahead. What am I supposed to plan 4 months in advance? No, Kyle. It was, hey, do you want to do something tonight? Are you tired? I'm not tired. Let's go do it. That's what happened, Kyle.
Okay.
That added to my week. So thank you, Kyle, for not even being sensitive to my hellish week. And then this morning I wake up, my wife was like, "Oh, here, happy birthday." And the kids, like, really, it was beautiful little picture that they did with like their footprints and everything. Like, that was really cute, And I was like, "Oh, what's for my?" They gave me a nice little gift for Father's Day, and I'm excited. And then I was like, and then it began. It was just more of like, okay, now let's watch cartoons. Nothing that I wanted to watch.
Sure.
It was like, let's watch cartoons. So it basically became Happy Father's Day for about an hour.
Okay.
My wife had like breakfast, and I'm feeling good about life. I'm like, man, this might be a special day.
Okay.
And then it just went to basically, let's just go and watch cartoons and do nothing that Dad wants to do. So to all the fathers out there, Happy Father's Day again. I know you didn't get anything you wanted, but it was fun. So yeah, man, that was my week, and that's how it ended.
That's well, you can only go up from there.
Yeah. That's a good way to put it. Or you can just go back to shitty on Monday.
You can level off and stay about the same.
Right. No, but thank you, man. This was a good therapy session, but I needed this, man. It was tough, man. Because in the end, I'm realizing more and more that dentistry, again, we always say this, right? Needs to pick up its vibe in general. It needs to just be better. Right. And I just think that we need to do better as dentists. And I say this every time, and I really believe this. And it's just, we need to figure it out, man. We need to figure it out.
And I think we need to figure out a way to elevate to what medicine is. Because
for certain things, because medicine is being taken over by corporations as well.
Right. So now comes my little therapy session. Not quite as long as yours.
Okay, good, because we don't have that much time.
No, we don't have that much time. So my question to you is, if you're going to go get a procedure done, a couple of crowns, root canal, a little bit of work that is going to cost a couple $1,000s.
Right.
You get the temporary crowns put on. You cancel your insert appointments.
So to put the final crown on.
To put the final crown
on.
You cancel it. You don't show up. You never call the office back. The office continues to try to reach out to you. Hey, we need to finalize this treatment. You put some money down on this. We need to. Why wouldn't you go back?
Hmm.
Because I
Hmm.
don't have an answer for that. I have
Well,
two cases sitting there right now, both female, both had jacked up front teeth,
right.
did root canals, did crown and bridge, got them in temporaries. They put one of them put $1,200 down, the other put 1,200, I think,
A
and
lot of money.
they disappeared. Now they still owe balance on their account, so that could have something to do with it. They don't have the money to pay the rest of it, and they're fixed
Well,
nice enough that they're presentable now.
that's
But
it.
why not? I've had people come back that have paid the full amount for a single crown, pay full amount, and never came back for the permanent crown. It doesn't, for a 10-minute procedure. You made it through the hard part. All you got to
Right.
do is get the thing cemented on, and they just don't come back. They don't call you back. They don't text back. Nothing. I don't understand it.
Well, I'm gonna say there's two things, right? So one, maybe they're just like you did the crown so well,
No,
the front teeth so well that they're like, I'm very happy with this. It
that's
was
not
way
the
better than okay.
case. I promise you that's not the case.
Okay. Okay. The second thing is life happens,
Yeah.
right? It's
Okay.
like I couldn't find a babysitter. Life happens.
Yeah.
You just have kids. You have a lot of things that you got to deal with, right?
Okay. Okay.
Maybe job situation. I mean,
Okay.
I know Wall Street looks good, but Main Street is
Yeah.
tough right now. So
Right.
maybe I can't take the time off to come in at your hourly your hours. So in that situation, maybe you might just need to call them and say, hey, how about a Saturday?
Yeah.
How about we bring you in on a Saturday or something to
Yeah.
just do it for maybe in 10 minutes
Yeah.
and see if that works? Because people may not have time to take off.
They have time to give me a 5-minute call back though. Everybody has
No,
time for a 5-minute
that-
call.
that's very true because they have time for social media. They have time.
Oh,
Yeah,
yeah.
I bet you they're
Oh, yeah.
posting crap on there all the time,
Oh,
but
yeah.
they don't.
Yeah.
Yeah, I know. Yeah. So that's it. So I don't know. I mean, those are the two things that I got for you. I
Okay.
don't get it either. I've never understood that where people will pay and then not show up for the final product. That'd be
Yeah.
like taking your car to get fixed and then just never picking up your car again. It's like, why would you do that?
Yeah.
You paid me.
Yeah.
Here's your product.
People are interesting times, interesting people, and trying to find the why people do what they want to do. I think you drive yourself crazy, which is what I'm currently doing. But
And this is where I'm at too.
it's interesting. People are complex things.
There's something special.
Yeah.
There's something special.
Yeah.
People are something special, and in the end, it is what it is, man.
Yeah.
How do I say this? We signed up for this.
Yeah. Yeah.
We signed up for this. It is what it is, man.
Yep.
So
Well,
thank you.
Yep. Thank you for the conversation. I'm glad you got some stuff off the chest, and hopefully this week turns out better for you.
It needs to. I don't know how it can go any further. Like it really does. If you hear me go, if next week you're like, "Yep," so you left dentistry. Why? You know why? It was another week, and I was like, you know what? Screw this. I'm done. I'm done. And then you're gonna see me like maybe either selling my body or something weird. It's gonna
Okay.
happen.
All right. Okay.
So
All
this is my last. I can't do. I don't have any other skills. I don't have any other skills. So and you will not see me in the NBA at all. So I do not have any other skills. So yes. And yeah, my wife will not let me just stay at home. So and I suck at assistance. So I can't go backwards. So it is what it is. But all right, boss. Thank you. Appreciate you.
Yep.
Enjoy your day, man. Tell your father I said happy Father's Day, boss.
I will. Happy Father's Day.
All right, man. Later.